Guidelines to cholesterol testing. Cholesterol is a waxy substance that your body needs to make hormones and digest fats. Your body makes all the cholesterol it needs. But you also get cholesterol from certain foods, such as egg yolks and fatty meats. Having high blood cholesterol can lead to plaque buildup in the arteries. This leads to heart disease and stroke. High blood cholesterol doesn't have symptoms. Therefore, getting your cholesterol levels checked is very important. How and when to have your cholesterol checked? You should get your cholesterol checked at least every 5 years. If you have cardiovascular risk factors, your doctors would advise you accordingly. Even children and adolescents should have their cholesterol checked. Pediatricians normally don't check a child's cholesterol until at least age 2. According to the National Heart, Lung and Blood Institute, (NLB), a person's first cholesterol screening should occur between the ages of 9 and 11, and then be repeated every 5 years after that. Especially on children with a family history of premature heart disease or severe obesity. The NLB recommends that cholesterol screenings occur every 1 to 2 years. For men between 45 to 65 years and for women between 55 to 65. A teenager might be checked if he has a family history of premature heart disease or other risk factors such as smoking, obesity or high blood pressure. People over 65 should receive cholesterol tests annually. Risk factors. What are risk factors for high blood cholesterol? 1. A family history of heart disease. 2. Diabetes. Type 2 diabetes raises bad cholesterol and lowers high-density lipoprotein, HDL, or good cholesterol. Raises the risk for heart disease and stroke. 3. Old age. As you age, your body can't clear cholesterol as well as it used to. 4. Gender. Men tend to have higher LDL and lower HDL cholesterol levels than women do. But after menopause, around age 55, LDL cholesterol levels in women increases. 5. Overweight or obesity. 6. Previous history of having had high cholesterol. 7. Physically inactive or sedentary lifestyle. 8. Unhealthy diet. 9. Smoking. 10. Polycystic ovary syndrome. 11. Underactive thyroid gland. 12. People undergoing treatment for high cholesterol require regular cholesterol testing to monitor the effectiveness of their treatments. How a cholesterol test is done. A cholesterol test is a simple blood test. Your doctor may tell you not to eat or drink anything except water for 9 to 12 hours before the test. It is possible to get accurate total cholesterol and HDL even if you have eaten recently. These lipids don't change much with a meal. But triglycerides and LDL are influenced by what you have just eaten. Their levels start to rise within an hour or two of a meal, and they stay elevated for 12 hours or so. That's why you are told to not eat anything overnight. Then blood is drawn first thing in the morning. A complete cholesterol test is also called a lipid panel or lipid profile. It is a blood test that can measure the amount of cholesterol, HDL, VLDL and triglycerides in your blood. Cholesterol test. A cholesterol test can help determine your risk of the buildup of fatty deposits, plaques, in your arteries that can lead to narrowed or blocked arteries, atherosclerosis. How do these tests using little blood drawn work? The blood reacts with chemical impregnated filter paper. A chemical in the paper converts cholesterol to hydrogen peroxide. More cholesterol means more hydrogen peroxide produced. The filter paper then wicks the hydrogen peroxide up, and your cholesterol reading depends on how far along the paper the hydrogen peroxide has been drawn. A scale alongside the paper gives your reading. Are these tests accurate? The main source of misinterpretation of a cholesterol test is not the laboratory, it is the person. 1. A reading may change depending on whether blood is drawn from a capillary or a vein. 2. Whether you are standing or sitting. 3. The composition of the recent meals. 4. Whether you have been ill recently. 5. If you are pregnant or taking drugs. 6. Whether you are losing or gaining weight. 7. Time of year. Cholesterol tends to be slightly lower during summer. Why complete cholesterol test is done. High cholesterol usually causes no signs or symptoms. A complete cholesterol test is done to determine whether your cholesterol is high and to estimate your risk of heart attacks, heart disease and diseases of the blood vessels. A complete cholesterol test includes the calculation of 4 types of fats in your blood. Total cholesterol. This is a sum of your blood's cholesterol content. Low-density lipoprotein, LDL, cholesterol. This is called the bad cholesterol. Too much of it in your blood causes the buildup of fatty deposits, plaques. In your arteries, atherosclerosis, which reduces blood flow. These plaques sometimes rupture and can lead to a heart attack or stroke. HDL cholesterol. High-density lipoprotein, HDL, cholesterol. This is called the good cholesterol because it helps carry away LDL cholesterol, thus keeping arteries open and your blood flowing more freely. Triglycerides. Triglycerides are a type of fat in the blood. When you eat, your body converts calories it doesn't need into triglycerides, which are stored in fat cells. High triglyceride levels are associated with several factors, including being 1, overweight, 2, eating too many sweets, 3, drinking too much alcohol, 4, smoking, 5, being sedentary, 6, having diabetes with elevated blood sugar levels. What do the lipid profile test results mean? Cholesterol levels are measured in milligrams, mg, of cholesterol per deciliter, dl, of blood. Ideal results for most adults are LDL, 70 to 130 mg/dl, the lower the number, the better. HDL, more than 40 to 60 mg/dl, the higher the number, the better. Total cholesterol, less than 200 mg/dl, the lower the number, the better. Triglycerides, 10 to 150 mg/dl, the lower the number, the better. Cholesterol numbers. If your cholesterol numbers are outside of the normal range, you may be at a higher risk of heart disease, stroke, and atherosclerosis. If your test results are abnormal, your doctor may order a blood glucose test to check for diabetes. Your doctor might also order a thyroid function test to determine if your thyroid is underactive. If your results show that your cholesterol level is high, don't get discouraged. You might be able to lower your cholesterol with lifestyle changes, such as quitting smoking, exercising and eating a healthy diet. Limit your alcohol consumption. Avoid high-fat and high-sodium foods, while maintaining a well-balanced diet. Eat a wide variety of vegetables, fruits, whole grain products, low-fat dairy products, and lean sources of protein. Exercise regularly. If lifestyle changes aren't enough, cholesterol-lowering medications also might help. Lowering high levels of LDL in your blood can help you avoid problems with your heart and blood vessels. Overall, high cholesterol is very manageable. The more proactive you are in making lifestyle changes and taking prescribed medications, the better results you will have.